Good afternoon, everybody, to all my friends in Egypt, and particularly those who are in Asyut attending the Cardio Egypt Diabetes Conference, which I'm sorry could not be with you in person, but as I promised, I will hopefully next year be there. Again, thanks, Dr. Nazi, for inviting me, and thanks for doing such a great job in organizing this meeting. Now, the topics assigned to me today to talk about the cardio-kidney metabolic syndrome, specifically called CKM, and I will emphasize the importance of my talk about the perivascular adipose tissue and the pathogenesis of this particular cardio-kidney metabolic syndrome. Now, this is a picture of our hospital, which all of you are familiar with now, some of the financial relationship. I would like always to start with a few questions at the beginning. So one of the first question is, perivascular adipose tissue, get used to the term PVAT, is commonly increased in metabolic syndrome, obese and diabetic, and also people with chronic kidney metabolic syndrome subject. The answer, you can think and you will definitely agree it's true. Next question is, perivascular adipose tissue volume may be increased in non-obese subjects. Yes, look to the Chinese and Asian who are slim and trim, but yet have problems with cardiometabolic syndrome due to the increased perivascular adipose tissue. Perivascular adiposity, cardio obesity, even without abdominal visceral obesity or other comorbidity, is a major risk marker. Yes, perivascular adiposity has been recently recognized as a novel risk marker in vascular biology, and I hope you will get familiar with it more and more in the future. Now, the main objective is get understanding of the risk of excess perivascular adipose tissue with and without abdominal adiposity and its pathophysiological link to the cardio-kidney metabolic syndrome. As you might see, the word EAT may be very appropriate, excess perivascular adipose tissue. Genetic through the gun, but the environment, as you might see, pulling the trigger for obesity and increased perivascular adiposity. Now, this is the educational objective. As you can see, I will 2 points. For that, will emphasize the role of the perivascular adipose tissue, as well as few words on the gut microbiota. Now, some of you may be confused about the term metabolic syndrome and cardio-kidney metabolic syndrome. There's two different stories here. Metabolic syndrome, which the term has been with us for ages, many decades, which really is a common risk factor, actually a constellation of risk factors, 3 out of the 5, i.e. obesity, hyperglycemia, hypertension, dyslipidemia. If you get 3 components, then you have this cardiometabolic syndrome. But it doesn't mean that you have the cardio-kidney metabolic syndrome, because at a late stage, sort of, actually a disease took place. But metabolic syndrome is a risk factor. It's still the first stage. Now, this is a definition, as I just said, in metabolic syndrome. And here's the definition now, as contrasted with the cardiovascular kidney metabolic syndrome, CKM. Get used to this title, as you know, is a complex disorder made up of cardiovascular disease, kidney disease, metabolic disorders such as diabetes and obesity. So now you know the difference between metabolic syndrome and cardio-kidney metabolic syndrome. If you look at it, the metabolic syndrome sort of the early stage, primary prevention here, but with this cardio-kidney is late stage or secondary prevention. Now, what caused that? Many interrelated risk question, like cardiovascular dysfunction, kidney dysfunction, metabolic dysfunction, inflammation, interconnected pathway, and the most important thing to think about, all this condition I mentioned earlier, obesity, diabetes, have increased the epicardial or pericardial or perivascular adipose tissue, which creating that, and later on you will know why. So the excess volume of perivascular adipose tissue is a major risk factor for cardiorenal dysfunction, CKM syndrome. Now, before going to that, now let us talk about the type of fat in your body. Carrying on, your fat have three different classifications. White fat, subcutaneous tissue, inert most of the time, no problem, just cosmetic. Brown abdominal visceral fat, which have a different messenger RNA than the third group, which we call inhomogeneous, perivascular, renal, epicardial. So interestingly enough, the renal and epicardial fat tissue belong to the same group of the inhomogeneous fat, same messenger RNA, like perivascular fat, different from the messenger RNA for the abdominal fat. Now, what is the definition of perivascular adipose tissue? Virtually all blood vessels, except the brain, are surrounded by adipose tissue. This perivascular adipose tissue, as I just mentioned to you, which is inhomogeneous and differentiated from some subcutaneous and abdominal by different messenger RNA, that is the perivascular adipose tissue, is actually encroached directly on the adventitia without visceral layer, and thus humoral factors secreted by perivascular adipose tissue have easy access to the blood vessels and accordingly act as a paracrine organ, creating a problem. So, in summary, that expansion of perivascular adipose tissue, which commonly increased for can secrete adipokines, and when it is in large amount, it becomes producing more hormone. How can we measure that? You can either imaging technique, as you might see on the slide, histologic analysis, but bioelectrical. Easiest one to measure of course, the CE. And indirect measurement for that, since we said the epicardial fat belong to that group, just measuring the epicardial fat volume can give you a hint about the perivascular adiposity in general. So once they are under normal circumstances, they are producing atherogenic and non-atherogenic hormones as listed here. Under normal circumstances, there is a balance, there's no problem. But once you have increased volume, the cell get bigger, the adipocytes become dysfunctional and produce more of this atherogenic hormone, which can create the problem. Therefore, increased perivascular adipose tissue, dysfunctional tissue, produce more atherogenic hormone, and this is the pathologic consequence which can create problems. So, here's a nice picture, better than 1,000 words. To the left, the normal epicardial and normal perivascular adipose tissue, small adipocytes. Look to the far right, become large when they are obese, diabetic, start produce all this unfortunate atherogenic hormone. Here a picture, nice perivascular fat around the heart is belong to the same group. Cardioadiposity is major risk factor. Ultimately, end with creating atherosclerosis and problem which called cardiovascular problem, and this can ultimately lead to end-stage problems such as heart failure, heart attack, etc. Also kidney disease. Now, picture again here good, staging the kidney metabolic syndrome. If you have nothing to the left, then you just stage 0. If you are overweight, obese, but no hypertension or hyperglycemia or dyslipidemia, then you are stage 1. Once you have this risk factor, you are stage 2. Once factors act in your endothelial cell, create endothelial dysfunction, subclinical atherosclerosis, that's already stage 3. When you end up with major problem, atherosclerosis with MI or kidney dysfunction, then you are at stage 4 of the cardio-kidney metabolic syndrome. So this is the staging of the cardio-kidney metabolic syndrome. The obese heart does the same thing. If you have initially just fat around the heart and asymptomatic, ultimately you might end up with a heart attack once you increase secretion for long periods of time, and that can be the problem. Time to recognize excess perivascular adipose tissue as a novel cardiovascular renal risk marker or factor for chronic cardiovascular kidney metabolic syndrome. The link now is fueled about the microbiota and vascular fat problem here. That all of us these days hear much about the microbiota, but I will just be brief here that there is a connection between the microbiota, if it's healthy versus not healthy. Like here, it is a lot of gut microbiome. Actually, there's trillions of this microbiome, which normal healthy microbiome is okay, but once dysfunctional, again, can create increased free fatty acid, glyceride, dyslipidemia, and all the problems. So time will not permit me to go over the influence of the gut microbiome, and you can actually read and see the slides, and so that this is a very important area with active research which contributing to the problem. There's a link between microbiota and perivascular adipose tissue specific epicardial fat and the good clinical research. So maintaining healthy gut microbiota is imperative. This can be accomplished balance of diet, regular exercise, appropriate antibiotic. So keep tuned. In the future, we will much more about the diet and microbiota and various medication which some people have been taking now, like prebiotic for improving gut microbiota. Also, interestingly enough, the probiotic that is fecal transfusion, sort of like you see in the picture, fecal transmission, giving transplantation from healthy person to sick person to improve their microbiota and their gut. So we have done quite a number of studies in this area. Time again will not permit me to discuss, but in a nutshell, we find that increased epicardial fat, as we measure by the CT scan, is associated with significant cardiovascular structure abnormalities, which could be also seen in literature. What is the, here you are at the meeting, what that means for me? What does it mean for me as a practicing cardiologist or internist? It means a lot that for based on the studies showed that this one is too much of it, that will be a problem down the road. So it's time now to decrease it with diet. There's some new medication now in the market, which we use for diabetes, which also reduce the fat around the heart, epicardial tissue. And this is now that also has a future consideration. Are we going to get everybody who is obese surgery for his obesity? What about if he doesn't have increased perivascular adipose tissue? So we have some clinical consideration here. Do the people who are what we call healthy obesity have less perivascular adipose tissue? The answer is yes. Then few home to take home messages here. The most important one, to note that excessive production of the atherogenic adipokines and local angiotensin are the pathophysiological link between perivascular adipose tissue, cardiomyopathy, metabolic syndrome. Now we have more other take-home message which you can read at your convenience and how important it is. Now, time to recognize excess perivascular adipose tissue. EAT is a novel cardiovascular renal risk factor beyond, with, and without abdominal and dorsal adiposity. That is very important information. This condition, unfortunately, is still underdiagnosed, undertreated, under control. Time for us to start look for it. Time for us to know that 1 ounce of early cardiovascular renal disease prevention is better than pounds of late treatment. Time to treat when you're still at the metabolic syndrome arena, stage 0 or 1. But if you wait till the stage 4, it's too late. There's no cure for CKM syndrome, but there is a prevention. Now, today we must practice evidence-based medicine, and we must be, all of us, to be preventive healthcare providers. Look what happened here to the Statue of David after 3 years in the United States. Obesity is a disease. We are in the US the fattest nation on the earth. Thank you for your immediate attention, and I will be more than happy to correspond with you if you have any question. And I wish you a great Congress. And thanks again, Dr. Nazi, for the invitation. And I promise you I will be with you next year. Have a good day and best wishes.